Once we have a thorough understanding of the internal structure of the medulla, we can talk about the two clinical conditions associated with the vascular lesions of the medulla. One is known as the medial medullary syndrome, and the other one is known as the lateral medullary syndrome. For this, we are going to have a quick look at the normal anatomical cross-section of the medulla at the level of the olive, where we can appreciate most of the nuclei and the arrangement of the fiber tracts in the medial part as well as in the lateral part. Medullary syndrome. This is a syndrome which is a consequence of the vascular lesion or the vascular interruption of the blood supply of the medulla, which involves the vertebral artery, particularly its medullary branch. This branch is responsible for supplying the medial aspect of the medulla. We need to be clear about the arrangement of the fiber tracts and the nerves exiting before we understand the concept. So, if there is a lesion of the medullary branch of the vertebral artery on one side, the structures affected will be on the medial aspect of the medulla. So, it will include the lesion of the corticospinal tract or the pyramids, lesion of the medial lemniscus, and the hypoglossal nerve is involved as well. Involvement of the pyramidal tract will manifest as a contralateral hemiparesis. Involvement of the medial lemniscus will cause contralateral loss of proprioception, 2-point discrimination, and vibration, while involvement of this hypoglossal nerve will manifest as the ipsilateral paralysis of the tongue muscles, which can be seen in a patient if we ask him to protrude his tongue. The tongue will be deviated to the side of lesion. Lateral medullary syndrome is a series of clinical manifestations which will result if there is a problem with posterior inferior cerebellar artery pica. The involvement of this artery is responsible for interruption of the blood supply to the lateral part of the medulla. So let's see what will be the consequence. The impact is manifested in the form of a syndrome which is also known as the Wallenberg syndrome. Structures that will be affected as a result of the lesion of the pica in the lateral part of the medulla will include: number one, group of nuclei which are responsible for sending fibers to the vagus nerve, which are the dorsal vagus nucleus, nucleus of tractus solitarius, and nucleus ambiguus. Number second, the group of vestibular nuclei. Number third, inferior cerebellar peduncle. Number four, spinal nucleus and tract of trigeminal nerve. Number five, lateral spinothalamic tract or the spinal lemniscus. And lastly, the reticular formation, which sends the reticulospinal tract. Lesion of the nuclei of the vagus nerve will result in the ipsilateral paralysis of the laryngeal muscles and the muscles of the pharynx, which will be seen as dysphagia and dysarthria in a patient. Involvement of the vestibular nuclei will be seen in the form of patient complaining nausea, vomiting, vertigo, and nystagmus. Involvement of the inferior cerebellar peduncle will cause ipsilateral cerebellar signs like gait or limb ataxia. Involvement of the spinal nucleus and tract or trigeminal nerve here will result in the anesthesia and loss of sensations on the ipsilateral side of the face. Also, the spinal lemniscus or the lateral spinothalamic tract is also involved, and that will be manifested as the contralateral loss of pain and temperature sensations. As the reticular formation is also involved, the descending autonomic fibers which travel with the reticulospinal tract, they will be impaired, and this can be manifested in the form of ipsilateral Horner syndrome.